Question 1. A patient's ECG shows irregular rhythm with no visible P waves. What is the rhythm? A. Ventricular tachycardia. B. Atrial flutter. C. Atrial fibrillation. D. Sinus tachycardia. Answer: C. Atrial fibrillation. Question 2. Which rhythm poses the highest risk for thromboembolism? A. Sinus bradycardia. B. Atrial fibrillation. C. Ventricular escape rhythm. D. Accelerated junctional rhythm. Answer: B. Atrial fibrillation. Question 3. What rhythm is characterized by a progressive lengthening of the PR interval until a QRS is dropped? A. First-degree block. B. Second-degree block type 1. C. Second-degree block type 2. D. Third-degree block. Answer: B. Second-degree block type 1. Question 4. Which of the following is a priority action for a patient in ventricular tachycardia with a pulse? A. Begin chest compressions. B. Prepare for defibrillation. C. Administer amiodarone. D. Call the rapid response team. Answer: C. Administer amiodarone. Question 5. What is the initial step when identifying artifact on a telemetry strip? A. Restart telemetry monitor. B. Assess the patient. C. Call the provider. D. Ignore the artifact. Answer: B. Assess the patient. Question 6. A wide, bizarre QRS occurring earlier than expected without a preceding P wave is indicative of A. Ventricular tachycardia. B. Atrial flutter. C. Premature ventricular contraction. D. Junctional escape beat. Answer: C. Premature ventricular contraction. Question 7. What condition does a sawtooth pattern on ECG suggest? A. Ventricular fibrillation. B. Atrial flutter. C. Atrial fibrillation. D. Junctional rhythm. Answer: B. Atrial flutter. Question 8. Which of the following patients should be assessed first by the nurse? A. Patient with sinus tachycardia and stable vitals. B. Patient with second-degree AV block type 1. C. Patient with ventricular tachycardia and blood pressure of 78/50 seconds millimeter of mercury. D. Patient with atrial flutter and rate of 90 BPM. Answer: C. Patient with ventricular tachycardia and blood pressure of 78/52 mmHg. Question 9. A nurse sees a flat line on the monitor. What is the first action? A. Begin CPR. B. Defibrillate. C. Call the code team. D. Check leads and patient responsiveness. Answer: D. Check leads and patient responsiveness. Question 10. In complete heart block, the atria and ventricles. A. Fire in sync. B. Are both bradycardic. C. Beat independently. D. Show prolonged PR interval. Answer: C. Beat independently. Question 11. A nurse is reviewing telemetry and sees torsades de points. What is the anticipated medication? A. Adenosine. B. Magnesium sulfate. C. Epinephrine. D. Atropine. Answer: B. Magnesium sulfate. Question 12. What is the priority intervention for a patient in asystole? A. Defibrillation. B. Transcutaneous pacing. C. High-quality CPR. D. Administer lidocaine. Answer: C. High-quality CPR. Question 13. A patient with third-degree AV block is symptomatic. What should the nurse prepare for? A. Cardioversion. B. Defibrillation. C. Permanent pacemaker insertion. D. Administration of diltiazem. Answer: C. Permanent pacemaker insertion. Question 14. Which task is appropriate to delegate to a UAP in a telemetry unit? A. Interpret rhythm strips. B. Administer oral antiarrhythmic. C. Report chest pain to the nurse. D. Adjust oxygen settings. Answer. C. Report chest pain to the nurse. Question 15. Which rhythm has no P waves, wide QRS complexes, and a rate of 20 to 40 BPM? A. Sinus bradycardia. B. Ventricular escape rhythm. C. Atrial fibrillation. D. Junctional rhythm. Answer. B. Ventricular escape rhythm. Question 16. A nurse sees a heart rate of 38 BPM with regular rhythm. Which patient symptom requires priority intervention? A. Mild fatigue. B. Dizziness upon standing. C. Alertness and stable BP. D. Warm extremities. Answer. B. Dizziness upon standing. Question 17. What should the nurse monitor after synchronized cardioversion for atrial fibrillation? A. Respiratory rate. B. Blood glucose level. C. Cardiac rhythm and signs of embolism. D. Hemoglobin levels. Answer. C. Cardiac rhythm and signs of embolism. Question 18. A patient is in SVT with HR 180 BPM. After vagal maneuvers fail, what is the next recommended intervention? A. Amiodarone. B. Adenosine. C. Atropine. D. Epinephrine. Answer. B. Adenosine. Question 19. A telemetry nurse observes a prolonged QT interval. Which electrolyte imbalance may be contributing? A. Hypernatremia. B. Hypocalcemia. C. Hyperkalemia. D. Hypermagnesemia. Answer. B. Hypocalcemia. Question 20. Which ECG change requires immediate action? A. Bradycardia with BP 124/78 mmHg. B. PACs every 5 minutes. C. Ventricular fibrillation. D. Sinus tachycardia at 105 BPM. Answer. C. Ventricular fibrillation. Question 21. A nurse notices a run of 6 consecutive wide QRS complexes without P waves at a rate of 160 BPM. What is this rhythm? A. Atrial flutter. B. Sinus tachycardia. C. Ventricular tachycardia. D. Junctional tachycardia. Answer. C. Ventricular tachycardia. Question 22. What is the immediate concern when a patient converts from atrial fibrillation to normal sinus rhythm? A. Hypertension. B. Bradycardia. C. Embolism formation. D. PVCs. Answer. C. Embolism formation. Question 23. A patient in ventricular fibrillation suddenly becomes pulseless. What is the priority action? A. Synchronize cardioversion. B. Administer epinephrine. C. Begin chest compressions. D. Assess blood pressure. Answer. C. Begin chest compressions. Question 24. Which feature best distinguishes junctional rhythm on ECG? A. Wide QRS complexes. B. Inverted or absent P waves. C. Sawtooth flutter waves. D. Irregular rhythm. Answer. B. Inverted or absent P waves. Question 25. Which rhythm requires transcutaneous pacing if symptomatic and unresponsive to atropine? A. Sinus bradycardia. B. First-degree AV block. C. Third-degree AV block. D. Atrial flutter. Answer. C. Third-degree AV block. Question 26. A nurse finds a patient unresponsive with pulseless electrical activity. What should be avoided? A. High-quality CPR. B. Defibrillation. C. Identifying reversible causes. D. Administering epinephrine. Answer. B. Defibrillation. Question 27. Which electrolyte imbalance is most associated with peak T waves? A. Hypokalemia. B. hypocalcemia. C. Hyperkalemia. D. Hypernatremia. Answer: C. Hyperkalemia. Question 28. A patient with new-onset atrial fibrillation is confused and hypotensive. What is the priority treatment? A. Vagal maneuvers. B. Synchronized cardioversion. C. Anticoagulation. D. Amiodarone drip. Answer: B. Synchronized cardioversion. Question 29. Which action can the nurse delegate to the UAP for a patient on telemetry? A. Check lead placement. B. Report rhythm changes. C. Take vital signs. D. Adjust alarm parameters. Answer: C. Take vital signs. Question 30. What is the clinical significance of frequent PVCs in a post-MI patient? A. No clinical impact. B. Indicator of hyperkalemia. C. Risk for ventricular tachycardia. D. Sign of electrolyte stability. Answer: C. Risk for ventricular tachycardia. Question 31. Which rhythm is defined by no electrical activity and a flat line on ECG? A. Asystole. B. P. C. V-Fib. D. Sinus arrest. Answer: A. Asystole. Question 32. In a telemetry unit, which patient should the nurse assess first? A. Pax with rate of 88 BPM. B. Sinus tachycardia with anxiety. C. New onset of atrial fibrillation. D. Sinus bradycardia with BP 132/80 mmHg. Answer: C. New onset of atrial fibrillation. Question 33. A nurse reviewing ECG notes a PR interval consistently greater than 0.20 seconds. This indicates A. Normal sinus rhythm. B. First-degree AV block. C. Type 2 second-degree block. D. Third-degree AV block. Answer: B. First-degree AV block. Question 34. Which rhythm is shockable in cardiac arrest? A. Asystole. B. P. C. Ventricular fibrillation. D. Sinus arrest. Answer: C. Ventricular fibrillation. Question 35. A nurse is monitoring a patient with rapid atrial fibrillation. Which order takes priority? A. Monitor potassium. B. Administer diltiazem 4. C. Schedule echocardiogram. D. Draw troponin level. Answer: B. Administer diltiazem 4. Question 36. What ECG finding indicates successful defibrillation from V-Fib? A. Continuing fibrillation. B. Flat line. C. Organized QRS complexes. D. P. Answer: C. Organized QRS complexes. Question 37. A nurse sees an irregular rhythm with 3 or more PVCs in a row. What is this rhythm? A. Sinus arrhythmia. B. Atrial flutter. C. Ventricular tachycardia. D. Bigeminy. Answer: C. Ventricular tachycardia. Question 38. Which intervention is indicated for a patient in bradycardia with signs of poor perfusion? A. Administer atropine. B. Synchronized cardioversion. C. Vagal stimulation. D. Amiodarone 4. Answer: A. Administer atropine. Question 39. What is the first step when identifying a third-degree AV block? A. Prepare for defibrillation. B. Start chest compressions. C. Notify provider immediately. D. Give epinephrine. Answer: C. Notify provider immediately. Question 40. Which rhythm has a rate of 60 to 100 BPM regular rhythm and P waves before each QRS? A. Sinus rhythm. B. Atrial fibrillation. C. Junctional rhythm. D. V-Tach. Answer: A. Sinus rhythm. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!